ऑब्स्टेट्रिशियन एंड गायनेकोलॉजिस्ट एट आस्था हेल्थकेयर दिल्ली। आज की वीडियो में हम डिस्कस करेंगे पैप टेस्टिंग यानी कि पैप स्मीयर के बारे में, जिसे हम एलबीसी के नाम से भी जानते हैं। आज की वीडियो में हम जानेंगे क्या हर वुमेन को पैप स्मीयर करवाना जरूरी है, व्हाट आर द बेनिफिट्स ऑफ द पैप स्मीयर, हाउ इज इट डन, आर देयर any precautions to be taken before the test being done, is any rest required after the test being done, is it painful, and many such more questions. सबसे पहले जानते हैं what is a pap test. A pap test or a pap smear or LBC is a test which takes the cells from the cervix, that is the opening of the uterus, and examines it for any abnormality. So pap smear is a simple test with the help of which we can detect cervical cancer even before it develops. Along with this, it also helps to know the infections in the cervix. So let us know what is cervix. Cervix is the opening of the uterus, the uppermost part of the vagina, and the cancer of this area is called as cervical cancer. So technically, every woman who has a cervix has potential to develop cervical cancer. Cervical cancer is one of the few cancers for which definite cause is known and for which a vaccine is available to protect against it. But even then, we see more than 1 lakh women diagnosed in India with cervical cancer, out of which more than 70,000 lose their life against cervical cancer every year. So, with the help of this simple pap smear and HPV vaccine, we can have 100% elimination of cervical cancer. Many countries in the world have decreased their cases of cervical cancer by including pap smear and HPV vaccine in their healthcare. So, how is a pap smear taken? For pap smear, your doctor will do the pelvic examination and then put a speculum inside your vagina, and using a cyto brush or a wooden spatula will take some cells from the cervix, and then this sample is sent to the lab and the report comes after 5 to 7 days. Is pap smear or the pap test painful? Not much. Some of the women may feel discomfort due to the speculum, but generally it is not painful. How much time does it take to do the pap test? Generally 3 to 5 minutes. Are there any precautions to be taken before? Yes. The pap test can be done when you are not bleeding. So make sure you go for a pap test once you finish with your periods, and avoid sexual intercourse or any application of vaginal creams or douching 1 to 2 days before the test. So, for what age group is the pap test recommended? Pap tests are generally recommended after the age of 21 till the age of 65. It can be started earlier if you are sexually active. So, pap test is done after every 3 years. Or you can go for co-testing, that is pap test along with HPV testing after every 5 years. What if you are not sexually active, or you were sexually active earlier but now you are not? Even then, discuss with your doctor, because most of the times pap smears are recommended even when you are not sexually active, or you were sexually active once but now you are not. What if you had undergone a hysterectomy? Discuss with your doctor what type of hysterectomy was done and whether you need a regular pap test. After the age of 65, if adequate pap testing was done before and the results were negative, you can discontinue the pap tests. So, what is HPV? HPV is human papilloma virus. This virus is practically responsible for all the cases of cervical cancer, some of the cases of anal cancers, vaginal, vulval cancers, and penile and throat cancers in males. We have different types of HPV. More than 200 types have been discovered. They are known by numbers. Some of them are categorized as low risk, which generally doesn't cause cancer, and the others are categorized as high risk, which are known to cause cancers. So, when along with pap test, we do our HPV testing, we try to know that whether you are having HPV infection or not. Generally, all women by the age of 30 who are sexually active are exposed to this HPV, but most of them do not develop any precancerous or cancerous lesions because your immunity fight against this HPV virus, and even either you have a minor infection or you don't have any infection at all. So what if your pap test results show abnormal findings? Not to worry, pap test is just a screening test. Even if it shows some abnormal findings, confirmatory tests are must to diagnose cervical cancer. So the take home of today's video is, if you are more than 21 years of age and you are sexually active, please discuss with your doctor the significance of pap test and discuss whether you want to go for pap test alone or you want to go for co-testing. Even if you have missed your